In a typical day, Brian Smith might very well find himself working on a patient suffering with kidney stones.
When they go into the urology suite and they haven't been able to extract the stone, a lot of the times we have to put a drain in through the back so that we can get the kidney functioning.
But one very strange day, just a few hours after he left work in the angio suite, Brian was back at the hospital as a patient.
Laying out in the hallway where normally the patients lay and everyone's walking by, it's like, that's Brian, what's he doing here?
No one was more shocked than Brian himself.
I was getting ready for softball and I went to walk up over the stairs and I buckled to my knees and couldn't make it up over the stairs in pain. Everything is going along just fine, and then you're just hit with waves of pain. It's like somebody hit you in the back with a baseball bat.
Brian managed to drive himself to emergency, where he was quickly diagnosed.
I had a CT scan and they identified it right away that it was a kidney stone.
He was pleased with the treatment he received in these familiar surroundings, but because Brian works in this area, he knows some of the equipment used in his treatment really should have been updated.
What we have existing in urology it's called the image intensifier unit, which is older technology. We had planned to replace it about 3 years ago, and the funding just hasn't been flowing. I've been stopped several times by urologists in the hallway here at Red Deer Hospital saying, I can't visualize the body parts and the stones, and we need to do something. They're trying to visualize structures and stones and cancers and abnormalities. I wanted to come to the foundation as a source of funding to make the replacement happen.
In 2013, supporters of the Festival of Trees will enhance patient care in diagnostic imaging, urology, and the operating room at the Red Deer Regional Hospital by purchasing a new imaging unit for the operating room. The equipment will help urologists determine causes of urinary tract infections, urinary incontinence, or structural problems, as well as revealing blockages such as stones, congenital abnormalities, or cancers.
The latest and greatest out there, it's called flat panel detector technology. It's just been Health Canada approved, and if we were to purchase this technology, which we fully expect to do, we would be the first in Alberta Health Services to have a unit like this in urology. There's no way that we can't improve patient care with the flat panel detector technology. It's just like taking a better picture with your camera. So when you get that beautiful, crisp picture, that's what this new unit's going to do for us.
Like say the tables are wider, bigger, they have a broader range of areas that they can actually utilize. The important thing with X-ray is the radiation dose. As you get bigger, your radiation dose goes up. With the newer equipment, the newer X-ray machines, your dose is staying down even with bigger patients. They're getting less radiation and more beneficial diagnosis from it.
We are the referral center, and this is where folks that are having trouble with their kidneys, with blockages and cancers, and this is where they come, and this is where they're referred to be seen by the specialist, and they deserve to be imaged on a high quality system.
Those who use the new equipment will have the many supporters of the Festival of Trees to thank. Central Albertans working together to replace an aging piece of medical equipment with state-of-the-art technology.
As soon as we received the go-ahead from Festival of Trees that yes, diagnostic imaging in the OR and urology is this year's recipient, everyone was so grateful in diagnostic imaging because we know this is the top priority.
For the Festival of Trees to be able to fund this, it's huge. It's wonderful actually, because I don't think they'd be able to get it without it. So being on the stretcher and on the table kind of, like I say, lets you see the whole other side of it. If you do get a kidney stone or something that the urology suite has to take care of, you'll be quite happy that it's there.